startling new numbers from the World Health Organization. It says 1 in 25 people have at least one curable sexually transmitted infection. That amounts to 1 million new cases daily worldwide, and more than 376 million new cases each year. Now, the report tracked cases of chlamydia, gonorrhea, and syphilis, among others. Health experts warn if left untreated, those can seriously affect a person's health by raising the risk for things like infertility, pregnancy, complications, and cardiovascular disease. Joining us here to talk about this is HIV Program Manager W. Jeffrey Campbell from the Houston Health Department. Glad to have you here on The Factor Uncensored. Do we see the increase in the number of STDs? Because people in the past, they saw HIV and AIDS as a death sentence.
Sure.
And when people started living longer with it, with the drug cocktails, and we stopped hearing about it, and so people stopped using the condoms again. Is that a possibility?
No, I think really what we're seeing is there are a couple of different reasons why we're looking at HIV and STD in new epidemic proportions. One is poverty. When we look at the correlation between poverty and HIV, most people who are living with HIV living in a state of poverty right now. When we look at other STDs, STIs.
But when you say poverty, how does that cause more people to get HIV and
social
STDs?
Determinants of health. So when you're talking about impoverished neighborhoods, we're talking about neighborhoods that have poor medical care, neighborhoods that have poor education or low education, neighborhoods where sex circles are small because people don't transport out of those neighborhoods. They do what they do in those neighborhoods. So if it's one person then having sex with 5 people in that neighborhood, you're going to mutate that that STD or that HIV diagnosis about 5 times.
And for dealing with the issue, how do we get a handle on this? 1 in 25. That's a lot of people.
That is a lot of people. So what the Houston Health Department is doing right now, last month we launched a new campaign called I Am Life. And it specifically targets those most vulnerable, and that is gay and bisexual, black and Latino male, and transgender persons. It's a campaign about PrEP, which is a take once a day pill that prevents HIV transmission or contraction. And it's also about treatment as prevention, where individuals who are living with HIV, when they're taking their medication every day as prescribed, then that lowers their viral load and makes it almost, I would say, impossible to transmit that virus.
When someone takes a drug like PrEP, does it give them the false sense that they can be promiscuous because I have this super drug, this magical pill?
Yeah, I think that's a myth that we continue to talk about. There's a thing called the PrEP whore, and really in reality, people that are taking PrEP, that first line of folks, were having unprotected sex anyway, or sex without condoms anyway. So I think it
won't make necessarily those who were using protection stop using protection.
No, because the prescription, it says use with a condom. And so if you're already using a condom, you're probably going to continue to use that condom.
What would be your best advice for those who are not quite sure about their status, if they have STDs or HIV? What should they do? Obviously, it's a tough situation to approach. It would make you nervous, scared to go take that test. So how can you push people or give them the confidence to go and get those tests done?
I think it's about the confidence. I think we try to make people comfortable in going to their private doctor or going to one of Houston's STD clinics, our sexual health clinics, or one of the other FQHCs around the city, going in, getting tested for HIV, getting tested for other sexually transmitted infections. We're there, and we are able to provide the service. So come in, see us, we'll get you taken care of.
All right, sir. If you're burning, go to the clinic. Thank you for coming.